to David. You were just hearing David's coverage of the President of the United States speaking about the nation's response to the COVID-19 pandemic ahead of a possible winter surge in cases. And President Biden, who knows that the country is anxious, knows that the country is looking to him as president to lead the action that's needed to get on top of this, tried to lay out an ambitious agenda for meeting the threat of the Omicron variant, which is now the dominant COVID variant in the United States. He said he was going to ramp up testing capacity. Private insurance will pay for testing. There'll be federal testing sites around. And he promised half a billion tests and a website that would direct people, make getting tested for COVID that much easier. The question on that is it too little, too late? But the president also outlined efforts to meet the hospitalization issues that will come with this Omicron variant. Many doctors and hospitals concerned about a surge in patients that could overwhelm the capacity to treat ordinary patients, patients who are looking for emergency care or even surgeries, elective surgeries that may be overwhelmed in certain parts of the country. And so he said the military will be called on to try and help with that. But let's bring in on the president's action plan, ABC News senior national policy reporter Ann Flaherty and Dr. Simone Wilds, infectious disease specialist at South Shore, and ABC News contributor, ABC News medical contributor and emergency physician Dr. Darian Sutton joins us as well as ABC News chief White House correspondent Cecilia Vega. Welcome to all. And I wanted to ask Ann first, our policy reporter, on that testing component. The president took some sharp questions on it. Is it too little, too late? Well, everybody's wanted to get a test over the past few months. Sometimes you got to wait for the lab to get it in. Sometimes they're hard to find. And the question is, should we have been better prepared? And what does the president's action initiative mean?
Well, Terry, I think that much is apparent. Anybody who has looked for rapid tests this week knows that this nation was unprepared for the holiday season. It's been weeks since the CDC urged people to test before they gather with family members. So, of course, now we're staring down Christmas and the New Year holiday, and there are no tests to be found. You know, we heard from Biden today. He said, I do not think this is a failure. He was very adamant about that. I was speaking to a senior administration official earlier this morning who was very defensive and saying, you know, look, we've put more tests on the market than the past administration did. Well, certainly at this point in the pandemic, that should be the case. But, you know, I think like a supermarket is unprepared to have enough toilet paper ahead of a storm. They're looking at this and saying, look, we just didn't have the production on this. We didn't have enough of these types of tests that we can put on. And keep in mind, we are not even sure if all of these tests can detect the Omicron variant. There are still so many questions about this. But I don't know that I buy Biden's answer when he says that nobody could have seen this coming. I think that we knew that new variants were going to come.
He was certainly tap dancing there. Cecilia Vega at the White House, who's covered this president and the previous president. This is now a failure across two administrations, whatever Joe Biden says.
And he said outright, Terry, this is not a failure. Look, the reality, I keep going back to what Dr. Fauci said this morning, and he said that this virus, this variant, Omicron, is likely going to peak now in a matter of weeks. And so all of these people that, as Ann just referenced, we are seeing in lines trying to find these tests. I just saw some down the street from my house here in Washington this morning, a long line wrapping down the block of folks trying to find testing. I've tried to find them for my own family myself, as many of us had. We are still at the end of this 2021 talking about asking the question, when can every American who wants an at-home test get one? And the reality is they can't get one right now. And with Dr. Fauci saying this variant could peak in a matter of weeks, this very well, these tests very well may come too late. Look, this is a big political question that this White House is facing. Clearly, President Biden was very perturbed. We cannot, though, take away from the fact that 500 million tests is a lot of tests. That is going to make a big dent come when they will be available. But the reality is we still don't know those details, Terry. Little details like how many tests a family can get. What will this website be able to handle so much of America getting on all at once? We've seen these crashes happen before. How many tests will be distributed and how they will be distributed. So a lot of questions that they have still as to whether this will make a dent and how this is going to fall into place.
And Celia, I know you got to go back to work and continue reporting today, but if I could just one more question, which is the president had this ambitious domestic agenda. He wanted to be a transformative president on so many issues, but it turns out that until he shows the country he can lead us out of the pandemic, he's going to be burdened, at least if not stymied, in these other areas. Do you get a sense that he's realizing he's the pandemic president until otherwise?
I think he does realize he's the pandemic president. I guess I would also look at it another way, Terry. I don't know that even if he gets out of this pandemic, given the realities of the town that you and I both cover, that he will be able to get much of his domestic agenda passed. With the pandemic withstanding, I mean, he is at a standstill on Capitol Hill in his own party. It's an absolute disarray. His friend, as he just referred to him, Joe Manchin, is the lone holdout on passing this key signature piece of legislation, Build Back Better, and getting it over the finish line. So, yes, he is a pandemic president. He very much knows that. And I think you see him today trying to show that he is trying to get this under control, particularly as it relates to the past administration. But pandemic aside, he's got so many issues here in this city that he can't seem to get his own party on board for.
He sure does. He seems a little stuck. Cecilia Vega, thanks very much for taking the time being with us on that. Thanks very much. And let me turn to Dr. Simone Waltz. First, you did see there, while Cecilia was describing the political challenges that the president is facing, back in March, he was over, 70% approval on the pandemic before the Delta surge had happened, and now he's sinking fast. But Dr. Waltz, if I could ask you about your sense of what the president announced today, that plan to distribute 500 million free at-home rapid tests beginning in January. So with the confirmed cases of this new transmissible variant, Omicron, in the United States, how important does testing become in the entire public health effort here?
Well, you know, Terry, testing has always been important. Ever since we started the pandemic about 24 months ago, we've always been stressing testing. And now more than ever, especially with the Omicron variant that is so transmissible, spreading not only here in the US, but across the world, testing is really going to be helpful to help us to identify those individuals that have this disease. And the key thing is we want people to be tested so that we can keep everyone healthy and safe. So we got to get the testing in the hands of the people.
And that is critical. All of us who are traveling. Let me go to Dr. Darian Sutton, who's joining us as well. And Dr. Sutton, I was listening to you talking to David about where we are right now in this pandemic. And I wonder about the importance of testing at home in advance of travel. Is that a lot of us are traveling? I'm going to Michigan to see the in-laws. There's a big gathering out there. How important is it for me and my wife and children to get testing before we go? And what if we can't find any?
You know, I think it's really important. I know that it's really difficult to have access to certain things, such as especially PCR testing, which is the most accurate. But I think any testing is better than none. Personally, my recommendation, if you have access to rapid antigen testing, I would use that test as close as possible to your travel. And I would hopefully you'll have more than that, because I would use it again after travel. And all of these tests, plus masking, choosing high rates of ventilation, making sure that everyone's vaccinated, using all of these mitigation efforts will help to reduce the risk as much as possible, but you always have to understand that the risk will never be zero. So operating in the best sense of caution is probably your best plan right now for the holiday period.
Thank you, Doctor. And Ann, let me come back to you on the other policy prong that the president had out there, which is that because of the concern of hospitals like where Dr. Sutton, Dr. Wilds are working, there's a concern about those hospitals getting overwhelmed. So the president now calling on some military component to shore up our hospital system. What can you tell us about that? How's that going to work?
That's right. This is a throwback to his early days in the presidency when, COVID, we had peaked in that January timeframe. He's talking about mobilizing 1,000 military members to surge to hospitals that need it. So we're talking about doctors, nurses, respiratory therapists. He's also talking about bringing back those FEMA test run sites and vaccination centers, EMS workers who can transport people from one hospital to another to keep one hospital from getting overloaded. They know this is going to be a big problem, probably the biggest crisis of his administration. I think they thought they could pivot quickly in the summer away from COVID. But as we've heard today, I don't think that's going to happen.
That is significant. So let me go back to Dr. Sutton for a minute as an emergency room physician there. When you hear about what the president is proposing, or speaking with David earlier about the concerns about your hospital, about what might happen for patients if that hospital gets overwhelmed, and what about hospitals in places where there's a lot more unvaccinated people? How do you read the president's plan helping you out, and how concerned are you about hospitals across the country?
I agree with the president in terms of projecting calm. Right now, we don't see any concerning signs that we should be panicking in whatsoever. When you compare right now to where we were at the beginning of the pandemic, we have made tremendous strides, not just in understanding this virus, but also its transmission, how to stop it. We have vaccines, we have pharmaceutical interventions. But one thing that we have not increased upon is hospital capacity. And that's what I'm concerned about. As I was stating, right now, we're dealing with not just the Delta variant, but also the flu and other respiratory illnesses, and hospitals are already reaching their high levels of capacity in the winter months as we normally do. My concern is that even if it's a small percent of this large wave of patients who are infected with the Omicron variant, that small percent might overwhelm our system beyond capacity. And that's what I get concerned about. So I think we can be calm, but I think we should try our best as much as possible to decrease the risk of transmission by using those mitigation efforts, making sure that we're vaccinated, and knowing our status by getting tested as much as possible.
And Dr. Darian Sutton, Dr. Simone Wilds, know that we will all be with you as much as we can, doing all we can to help you guys in the front lines, really, there, as we have had to before. And thank you very much for being with us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.